Dear guests, distinguished doctors, and representatives of Balkan societies, my name is Barbara Gross, and I'm the president of the Slovene ME Patients Organization, ZIBRA. Today, I would like to share with you the experiences of our members and the challenges we face in understanding and diagnosing complex chronic illnesses. The situation in Slovenia. In Slovenia, three very different conditions, fibromyalgia, ME/CFS, and burnout, are often treated as they were the same disease. Everything is simply labeled fibromyalgia. The dominant belief is that these conditions cause chronic, widespread pain linked to burnout and that the nervous system is overreacting to something modern medical devices cannot detect. From this, many doctors conclude, sometimes even state outright, that the pain is exaggerated without a real physical cause. And therefore, you just need a healthy lifestyle and psychiatric care. As a result, our MECFS boards rarely take the illness seriously. They do not recognize MECFS as a distinct disease, and they have no guidelines on how to treat patients. MECFS is almost always equated with fibromyalgia. Many of our members develop ME/CFS as a clear trigger, an infection, major stress, trauma, or another event. But even before that trigger, their health wasn't optimal. They simply didn't notice. Why? Because they pushed themselves. They wanted to be useful members of a society, so they ignored or hid their symptoms. And these small symptoms were many stomach problems, they had migraines, body pain, allergies or intolerances, palpitations, dizziness, asthma, frequent infections, slow recovery times. For them, this was just normal life. But I ask myself, was it? What is PAM? One of the key symptoms of ME/CFS is PAM, post-exertional malaise, or exhaustion after extension. Um, Think about this. When a healthy person goes for a walk, the body produces energy. Mitochondria, the cell's energy factories, make this happen. But in MECFS, the mitochondria do not produce enough energy. So when the person moves, the body uses up its limited reserves and does not refill them. This led to hypoperfusion, reduced blood flow, uh, and hypoxia, reduced oxygen supplied to tissues. Both have been scientifically demonstrated. And PAM is not exclusive to MECFS. Did you know that many chronic diseases, if left untreated, also cause chronic fatigue and even PAM? MECFS is not the only disease that causes hypoxia in the tissues. Um, there are several diseases where PAM is constant and others where it appears only when the disease is active or untreated. Among our members, many conditions were left undiagnosed for years. Only after long journeys from clinic to clinic were they finally discovered. These conditions, um, these conditions are serious, underestimated, difficult to diagnose, and doctors often lack clear treatment guidelines. Here are the most common ones among our members. First, Ehlers-Danlos syndrome, EDS, is a genetic connective tissue disorder. EDS always causes pain. Many patients also have POTS or symptoms of POTS and MCAS, mast cell activation. These three conditions overlap frequently. Then Marfan syndrome, Lloyd-Dietz syndrome, osteogenesis imperfecta. Yes, even genetic diseases can go unnoticed. often. Then polymyositis, ascites and dermatomyositis, vasculitis, they have lupus, scleroderma, mixed connective tissue disease, Sjögren's syndrome, antiphospholipid syndrome, endometriosis, polycystic ovary syndrome, ankylosing spondylitis, adrenal diseases like Addison and Cushing's, thyroid diseases, severe allergies, and mast cell activation, as mentioned. Intolerances, not allergies, they have absolutely nothing to do with them. Intolerance is enzyme deficiency or inability to break down some substances in our body, and this is causing inflammation in capillaries and endothelial dysfunction. The most common seem to be multiple chemical sensibility and food sensibility. Intolerance is lack of enzymes to break up some food or environmental chemistry and mold. And then our members have metabolic diseases like osteoporosis, chronic gut issues, leaky gut, and similar. Then Raynaud's phenomena, vasospastic angina, microvascular disease, angina. All these illnesses can cause chronic fatigue and when active, pain. And there are many more. Behind each disease, there is a real person with a real story. And what we discovered when we encouraged members to continue searching for the answers, we found extremely serious conditions such as CADASIL, which can cause aneurysms and Parkinson's disease, where tremors or skin changes were misdiagnosed as ME or fibromyalgia. And even after proper diagnosis, some doctors still claimed the symptoms were psychological. The same happens to patients who develop organ damage like heart failure or pulmonary hypertension and are still sent to psychiatrics instead of receiving urgent medical treatment. We have members who were eventually diagnosed with myasthenia gravis or multiple sclerosis, MS. They had swallowing issues, muscle weakness, eye symptoms for reasons completely unrelated to fibromyalgia or ME, but were still told their pain and fatigue were exaggerated and unjustified. Even with a clear diagnosis, the blame is often shifted to the patient's psyche. This is terrifying. Let me be clear, psychiatric support is valuable. When the medical system gives up on you, a psychiatrist may be the only professional who listens, but psychiatric care cannot replace medical diagnosis and it must not be used instead of medical investigation. We want patients to discover the underlying illness causing their PEM and hypoxia, lack of oxygen in their tissue, because these conditions can be treated. Medicine can help, but only if we look beyond the most common explanations. If the conditions were simple and easy to diagnose, these patients would already have answers. The fact that they don't means we must search for the less obvious, less frequent causes. When severe, poorly understood disease go untreated, disease is commonly mislabeled as fibromyalgia or ME or burnout. Patients' immune system become exhausted. They become vulnerable to reactivation of Epstein-Barr, zoster, herpes viruses, Lyme, Bartonella, Coxsackie, and others. The bodies are fighting constant inflammation and injury without proper medical support. Meanwhile, they must prove they are ill, they are sent back to work, they are not believed. Is it any wonder their immune system collapses? And is a healthy lifestyle and psychiatric treatment really enough for disease like connective tissue disorders, serious metabolic, hormonal, and autoimmune diseases, or even rare genetic conditions? So the big question is what comes first? Is it immune system causing the disease? Or is the disease, especially when untreated, completely destroying the immune system? We do not know. Medicine does not know. Perhaps many people lived with an undiagnosed rare disease in childhood. They coped with small symptoms for years without realizing something was wrong. Then came stress, trauma, or infection, a trigger, and suddenly PEM appeared because of inflammations that cause hypoxia, along with a severe form of ME. They were diagnosed with ME or fibromyalgia and all further investigations stopped. Your condition worsens, your immune system does not work as it should, you're constantly ill, and the underlying disease which caused you to get ME has still not been treated. Is it possible? We don't know. And medicine doesn't know either. Or maybe it is opposite. The trigger came first, caused severe ME and PEM, hypoxia occurs. You get your ME fibromyalgia or burnout diagnosis, your door for further investigations are closed. Your condition worsens, the immune system weakened, and an additional disease one they were predisposed to was able to break out and has still not been treated. Which option is correct? We don't know. And the medicine doesn't know either. Thank you for listening and thank you for being open to understanding these complex and deeply human stories. Our goal is simple to improve diagnosis, treatment, and most importantly, the lives of the people behind these diseases.